Welcome to our session on employer-sponsored healthcare coverage. My name is Aaliyah McKinley, and I'm the Director of Community Outreach and Education at the Asclepius Initiative. The name Asclepius is a bit of a tongue twister, but there were already so many wonderful organizations with the words Kentucky and health in their names. You may not be able to spell, pronounce, or remember it, but at least you'll recognize it if you see it again. Asclepius represents medicine and healing in Greek mythology. The mission at the Asclepius Initiative, or TAI for short, is to provide education and build support for the idea that everyone in the U.S. simply has continuous healthcare coverage from birth until death, so that you don't lose your insurance if you leave your job, get divorced from the policyholder, or move across state lines, events that can happen to any of us at one time or another. Nearly 49% of Americans and more than 45% of Kentuckians get their coverage through their work. Employer-sponsored coverage is frequently described as a benefit of employment, although almost all employees contribute something towards the monthly premium costs, typically around 20 to 25%. As an example, 2025 family premiums averaged $26,993, with workers paying an average of $6,850 and employers paying the rest. Despite having employees absorb some of the premium costs, this arrangement can still be less expensive than independently buying insurance through the health insurance marketplace, Connect in Kentucky. However, costs can vary, especially if marketplace premium subsidies or cost-sharing reductions are available. Although many employers offer healthcare coverage, not all do. Of those who do, not all employees necessarily qualify. Typically, someone must be considered full-time in order to be offered health insurance. It may also depend on exactly how many hours they work, their age, the size of their employer's workforce, or other factors. Also, be aware that coverage is not necessarily immediate upon starting a job. You may need to work for a new employer for as much as 90 days before your coverage becomes active. When healthcare coverage is not offered through work, people needing it must look for other options. In these situations, individuals may be able to obtain coverage through the marketplace, through their spouse or partner's plan, through public programs such as Medicaid, Medicare, or the VA system, or via other coverage options for which they may qualify. Despite the benefits of coverage, it's important to remember that covered doesn't mean free. Beyond whatever you may pay towards your monthly premium, you are responsible for out-of-pocket costs that usually include deductibles, co-pays, and co-insurance. Many modern plans have high deductibles, meaning you may pay thousands for non-preventive care before your insurance kicks in. Understanding these costs can help you budget and temper the sticker shock when you get your medical bills. When it comes to employer-sponsored coverage, both employers and employees make decisions. Employers decide which plans to offer and how much of the cost they will bear, the plan structure, such as HMO versus PPO, whether out-of-network benefits will be included, and whether or not they will make health savings programs available. Employers must balance the cost to their business with offering a level of benefits that will attract and keep workers. Employees then decide whether they want to enroll in the coverage being offered, whether or not to include their family members on the plan if that's an option, and if more than one plan is available, which choice best meets their needs. To help with out-of-pocket costs, employers may offer special programs that allow their employees to save money on healthcare expenses. FSAs, HSAs, and HRAs allow you to use pre-tax dollars to pay for qualified medical expenses, such as co-pays, co-insurance, deductibles, prescription medications, and even many over-the-counter items like pain relievers and pregnancy tests. You save money by not paying taxes on the contributions to FSA, HSA, and HRA accounts. The money in these accounts can then be used to pay for qualified medical expenses. The IRS limits the annual contributions to these accounts. While they all help you to save money, FSAs, HSAs, and HRAs differ in several ways. Flexible spending accounts, or FSAs. Flexible spending accounts also allow pre-tax money to be used for qualified medical expenses. Similar to HSAs, both the employer and the employee may contribute to an FSA, typically through payroll deductions. In 2026, the total FSA contribution limit is $3,400. A key distinction between FSAs and HSAs is what is commonly known as the use it or lose it rule. FSA money that is not used by the end of the plan year is generally forfeited. Some employers allow a limited rollover or a short grace period. Contribution limits and rollover amounts typically change from year to year. Health savings accounts, or HSAs. Contributions to HSAs are tax deductible. The funds grow tax-free, and withdrawals for qualified medical expenses are also tax-free. To open and contribute to an HSA, a person with employer-sponsored coverage must be enrolled in what is known as a high deductible health plan, or HDHPs. These plans typically have lower monthly premiums but higher out-of-pocket costs compared to non-HDHP plans. If an HSA is offered through an employer, contributions to the HSA may be made by the employer, the employee, or both. There are annual contribution limits. For 2026, individuals can contribute up to $4,400, and the contribution limit for family coverage is $8,750. Individuals age 55 or older can contribute an additional $1,000. One key benefit of an HSA is that the funds remain with the individual even following termination of employment. Health reimbursement arrangements, or HRAs. Health reimbursement arrangements are employer-only funded accounts used to cover healthcare expenses. HRAs are owned and funded entirely by the employer. Employees can use these funds for eligible expenses based on rules set by the employer and applicable regulations. Unlike HSAs and FSAs, in some cases, HRAs can be used to help pay for health insurance premiums. HSAs, FSAs, and HRAs have rules and contribution limits, and not all employers or insurance plans offer them. This comparison chart can be used as a quick reference to distinguish between HSAs, HRAs, and FSAs. Key highlights include: if the insured person's account is a health savings account, they own the account. If the account is a health reimbursement arrangement or flexible spending account, the employer owns the account. The insured individual with employer-sponsored coverage must have an HDHP in order to have a health savings account. Only the employer can contribute money to an HRA. Both the employee and the employer can put money into the account if it's a health savings account or a flexible spending account. Only HSA funds can be invested and earn interest, and you must report the account when you do your taxes. And finally, remember that FSA monies, for the most part, are use it or lose it funds. By its very nature, healthcare coverage benefits tied to work is vulnerable. When employment changes, coverage access and costs often change as well. In some cases, this results in loss of coverage when it is needed the most, such as becoming too sick to work. Someone may also lose their employer-sponsored coverage after reducing their hours, switching to contract work, or losing their job altogether. Other causes of loss of job-based coverage include divorce from or death of the employee policyholder, employer dropping coverage, turning 65. Note that for those who are eligible for Medicare, Medicare must be the primary coverage for employees of organizations that employ fewer than 20 people, and retirement. For employees who resign or are let go from their position, COBRA may be available. COBRA allows a person to keep the same employer-sponsored plan for a limited time, typically 18 months, but it can be as much as 36 months in special circumstances. However, the now former employee is responsible for the full cost of the premium. Since the employer is no longer paying any portion of the premium cost to the former employee is usually much higher. COBRA can provide short-term protection, but the price can make it difficult to maintain coverage. Most employers have an annual open enrollment period that can vary by employer. During open enrollment, you can sign up for initial coverage, change plans when more than one option is offered, or add family members when family coverage is available. The timing of the open enrollment period can vary depending on the type of coverage, employer, or government regulations. Outside of the open enrollment period, the opportunity to sign up for or change coverage is usually limited. However, certain life events can create a special enrollment period. These events may include getting married, having a baby, retiring, or losing job-based insurance coverage. A special enrollment period provides a short window to enroll in new coverage or make changes to an existing plan. If the deadline is missed, it may be necessary to wait for months until the next open enrollment period. Also, note that for new hires, employers can require a waiting period of up to 90 days before coverage starts. Having employer-sponsored health insurance means more than just signing up for a plan. Knowing how coverage works, understanding costs, and where limitations may exist empowers workers to make decisions that best meet their medical and financial needs. Thank you for coming to our session on employer-sponsored healthcare coverage. Last step, please take our survey. It's the QR code to the left. It helps to show our funder that people are using this material and increases the chance that we will be able to continue to provide useful information on healthcare coverage in the future. The middle QR code will take you to our educational materials on the TAI website. We have a lot of amazing free resources on our website, and I encourage you to check that out. If you are interested in staying up to date with the Asclepius Initiative, there's a lot of great information that we share on our monthly newsletter. Feel free to scan this QR code, the one to the right, to sign up for that. We don't do anything with your information other than send you a great newsletter every month. You can follow us on the following social media sites or on LinkedIn, Facebook, Instagram, Blue Sky, and YouTube. I want to thank the Kentucky Department for Public Health and their grant that lets us bring this information to you at no charge so that people like you and me can get the resources we need to better understand our healthcare coverage.